Hello everyone, and welcome to the second Zenith. I'm your host, Dr. Arthur. As we age, our bodies undergo a multitude of changes, some of which can be quite challenging to navigate. One of the most common issues that many of us face after the age of 60 is arthritis. I've seen it in my practice, and I've experienced it myself: the aching joints, the stiffness, the difficulty in performing even the simplest tasks. But today, I want to talk to you about arthritis pain, and what we can do to manage it. As we get older, our joints naturally start to wear down. The cartilage that cushions our bones and allows them to move smoothly starts to break down, and the ligaments and tendons that hold our joints together start to lose their elasticity. This can lead to pain, stiffness, and limited mobility. And for many of us, this can be a real challenge. I've had patients who have had to give up activities they love, like gardening or playing with their grandkids, because the pain and stiffness have become too much to bear. But here's the thing: we don't have to let arthritis pain control our lives. There are many things we can do to manage our symptoms and stay active, even after the age of 60. One of the most important things we can do is to stay physically active. Now, I know what you're thinking: if my joints hurt, why would I want to move around? But the truth is, gentle exercise can actually help to reduce pain and stiffness. Activities like yoga, swimming, and cycling are great options, because they're low impact and easy on the joints. I have a patient, let's call her Margaret, who was diagnosed with osteoarthritis in her hips and knees. She was in a lot of pain, and she had to use a walker to get around. But she was determined to stay active, so she started taking a gentle yoga class at her local community center. At first, it was tough; she had to modify many of the poses to accommodate her joints. But over time, she started to notice a real difference. Her pain decreased, her mobility increased, and she was able to start doing things she thought she'd never be able to do again, like playing with her grandkids and taking short walks around the block. Another important thing we can do to manage arthritis pain is to maintain a healthy weight. When we're carrying around extra pounds, it puts additional stress on our joints, which can exacerbate pain and stiffness. So, eating a healthy diet and getting regular exercise can help us to lose weight and reduce the strain on our joints. Now, I'm not saying it's easy. I know how hard it can be to make healthy changes, especially as we get older. But I will say that it's worth it. Every pound we lose can make a real difference in our joint health. In addition to staying active and maintaining a healthy weight, there are also many treatments available that can help to manage arthritis pain. Medications like acetaminophen and ibuprofen can help to reduce pain and inflammation, and physical therapy can help to improve mobility and strength. Some people also find relief with alternative therapies like acupuncture and massage. I've had patients who have tried all of these things, and what works for one person may not work for another. But the key is to keep trying, and to work with your healthcare provider to find the right combination of treatments that work for you. Now, I want to talk about something that I think is really important, and that's the emotional toll of arthritis pain. When we're in chronic pain, it can be really tough to stay positive and motivated. We may start to feel like we're losing our sense of purpose, or that we're no longer able to do the things we love. But I want you to know that you're not alone. There are many resources available to help you cope with the emotional aspects of arthritis pain, from support groups to counseling to online communities. And I want to encourage you to reach out and connect with others who are going through similar experiences. On the second Zenith, we're all about supporting and empowering each other as we navigate the challenges of aging. And I want to invite you to join our community, to share your stories and your experiences, and to connect with others who understand what you're going through. We have a wonderful group of people who are passionate about healthy aging, and who are dedicated to helping each other thrive. As we come to the end of our time together today, I want to leave you with a message of hope and encouragement. Arthritis pain may be a challenge, but it's not a definition. You are still the same person you've always been: vibrant, capable, and full of life. And with the right combination of self-care, treatment, and support, you can manage your symptoms and stay active, even after the age of 60. So don't give up, my friends. Keep moving, keep pushing forward, and know that you're not alone. If you've enjoyed this video, please be sure to subscribe to the Second Zenith, and hit the notification bell so you can stay up to date on all our latest content. And if you have any questions or comments, please leave them in the section below. I'd love to hear from you, and to hear about your experiences with arthritis pain. Thanks for watching, and we'll see you in the next